Today I am going to discuss questions from cardiovascular system. First question. The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? So the client is diagnosed with essential hypertension and the nurse is giving instructions related with exercise. So which instruction should the nurse provide when discussing exercise? So you have to select the correct statement regarding exercise which can be given for a patient with essential hypertension. Okay, so we'll read the options. Please remove the wrong answer first. Number 1, walk at least 30 minutes a day on flat surface. That can be selected as a correct answer. And second one, perform lightweight lifting 3 times a week. Recommend high level of aerobic daily and encourage the client to swim laps once a week. Whereas encourage the client to swim laps doesn't require for a patient with hypertension. So you can remove option D. And high level of aerobic exercise, that is also not recommended for a patient with hypertension. So I think D and C can be removed. And then there are 2 answers, A and B. So what is A? Walk at least 30 minutes daily. So this can be selected as answer. So when we compare between A and B, the better answer is A. Okay, so for a client who is diagnosed with hypertension, they have to continue exercise. So what exercise is recommended for a hypertensive client? Walk for 30 minutes a day, which should be on a flat surface. Okay, next question. Nurse just received AM shift report, that is morning shift report. Which client should the nurse assess first? So when you just enter into a hospital and when you got a morning shift report, there are 4 patients which is given in the option, and which patient you would go and assess first. Number 1, a client diagnosed with a coronary artery disease that has a BP of 170 by 100. So 170 by 100, this BP is considered as a higher BP. You have to assess, but we'll see. The client diagnosed with a deep vein thrombosis who is complaining of chest pain. So currently the patient is complaining chest pain here. Okay, a client who is already diagnosed with a deep vein thrombosis and is having chest pain. So what is a sign of chest pain? What it is indicating when a client complains chest pain? So you can relate this chest pain, could be pulmonary embolism or something like that. See, deep vein thrombosis is a common condition where the patient is immobile, and the complication of deep vein thrombosis could be pulmonary embolism when the patient starts to mobilize. Okay, so this have to assess first. We'll see. See, if you get a correct answer, but you have to make sure that the other 2 options are also wrong. Okay, and see, the client diagnosed with a pneumonia that has a pulse of C reading is 98. This is quite normal one, so you can just skip this. And a client diagnosis with ulcerative colitis that has non-bloody diarrhea, which is also indicating a proper solved problem. Okay, so D can be removed, C can be removed, then A and B. So from A and B, the correct answer is chest pain. Fine. So B option, the client diagnosed with deep vein thrombosis who is complaining chest pain. For that patient, you have to go and assess first and do interventions. Okay, so we'll see next question. A client diagnosed with essential hypertension asked the nurse, I don't know why my doctor is worried about my blood pressure. I feel just great. Which statement by the nurse would the most appropriate response? So what is the current situation here? Patient is diagnosed with essential hypertension, whereas the patient is not aware regarding this diagnosis, and the patient is asking the nurse why the doctor is worried about my blood pressure. Okay, so by listening this particular statement, you came to know that the patient is not aware regarding, or the patient doesn't have a proper knowledge regarding her or his diagnosis. So which statement by the nurse would be most appropriate response? Okay. So when you just reply the client, you have to use a appropriate response. Okay. So which of the following is indicating that most appropriate response by the nurse? Okay. We'll read the option. Number 1. Damage can be occurring to your heart and kidney even if you feel great. Unless you have a headache, your blood pressure is probably within normal limit. C. When is the last time you saw your doctor and does he know you are feeling great? Your blood pressure reflects how well your doctor is working. So what is the correct answer? We can just again read the question. Client is diagnosed with essential hypertension. Ask the nurse, I don't know why my doctor is worried about hypertension. So what could be the answer? You have to plus read and understand the option, and you need to just try to remove the wrong answer. See, I think D can be removed. Your blood pressure reflects how well your heart is working. It can be, but mainly blood pressure is reflecting how well the blood vessels are reacting towards the blood which is flowing through the blood vessels. I think D can be removed. And when is the last time you saw your doctor and does he know you are feeling great? I think this is also not an appropriate statement, right? And unless you have a headache, your blood pressure is probably within normal limit. C, option B is not the correct statement. Obviously, yes, in hypertension there will be chances to get headache, but what option B says, unless you have headache, your blood pressure is probably without, within normal limit. Okay, even blood pressure will be high and there won't be any headache. That is also expected in hypertension. And here it is only diagnosed with an essential hypertension. So I think B is not suitable. So the correct answer for this is damage can be occurred to your heart and kidney even if you feel great. So essential hypertension is indicating that your kidney and the heart is having a problem. Fine. So the correct answer for this question is A. Okay. Out of this, the complete wrong answer is D and C can be easily eliminated, and B and A, when you compare between this, the correct answer for this question is A. Damage can be occurred to your heart and kidney when if you feel great. Fine. Do you have any queries? Then we'll move to another question. A nurse is teaching a class on arterial essential hypertension. Which modifiable risk factor would the nurse include when preparing this presentation? So what is the meaning of the question here? Patient is admitted with essential hypertension and the nurse is preparing a class for that patient. Okay. Which modifiable risk factor? Please remember, which modifiable risk factors would the nurse include when preparing this presentations? Okay, so you should know what are the modifiable risk factors. Risk factors for hypertension can be divided into modifiable factors and non-modifiable factors. What is modifiable factors? That can be modified by the person. Right? What is non-modifiable factors? Which cannot be modified by a patient. For example, age, gender, heredity. Okay, so hereditary, age, gender. These are the terms which cannot be modified by person, which is considered as non-modifiable risk factors. What is modifiable risk factors? Sedentary lifestyle, obesity, lack of exercise, diabetes. Fine. So these are the certain factors where it can be modifiable. So you have to select the modifiable risk factors. Fine. First thing, include information on retinopathy and nephropathy. See, which is not related with essential hypertension, but in case of essential hypertension, there will be chances to get retinopathy. Okay, fine. Discuss sedentary lifestyle and smoking cessation. Yes, that can be considered as a modifiable risk factor. But still, you got the answer, but still you have to just read other two options and you have to make sure that other two options are also wrong. Fine. Include discussion on family history and gender. This is considered as a non-modifiable risk factor. So you can remove this. Provide information on a low fiber and high salt diet. Yeah, this is something wrong. Why? Because see, dietary modification is included or it can be considered as a modifiable risk factors, but here information is given regarding low fiber and high sodium diet. It is wrong. You have to give low sodium and high fiber diet that will reduce hypertension. So what is the answer for this question? It is discuss sedentary lifestyle and smoking cessation. So please remember what are the modifiable factors and what are the non-modifiable factors for hypertension and coronary artery disease. Okay.